My next story takes us to Brockton, Massachusetts to discuss the opioid crisis and how the city is supporting its citizens and families struggling with addiction. For years, the opioid crisis in cities like Brockton has become worse, with many suffering from addiction, unable to get the proper treatment they need. Data from the CDC showed that death by overdose in Brockton has steadily increased since the COVID-19 pandemic, a trend that matches what officials at the Massachusetts Department of Public Health are also seeing statewide. Many deaths are being attributed to the use of a drug called fentanyl. According to the DEA, just 1 kilogram of fentanyl could kill up to 500,000 people. This opioid is said to be 50 times stronger than heroin. A local police officer noted that, while there is more fentanyl on the streets, people are now being educated on the use of Narcan and it's saving lives. Narcan is emergency medicine used to reverse the effects of an opioid overdose. Many nonprofit agencies, like BAMC, who opened a community outreach, prevention, and education center, support residents suffering from drug addiction, who may also be at high risk for contracting HIV due to the sharing of unclean needles. This center, like many others in Massachusetts, receives partial funding from the Massachusetts Department of Public Health, and their goal is to see a decline in the city's number of annual drug overdoses. Joanne Peterson, founder of Learn to Cope, another nonprofit agency providing education and resources to families who have loved ones suffering from addiction, stated that in her experience, it takes an average of 7 years for most addicts to seek out recovery programs and support. Peterson also sadly noted that, unfortunately, a number of folks die as a result of their addiction before getting the help that they need.